Anti-drug tebagiteesezayo yeteesa bwetusawa bwetuuka nga eyagala.
At Kampala Youth Recovery Foundation, the Ghetto youth occasionally meet to give their testimonies on how they are battling and recovering from drug addiction.
Mbeera eyo drug yannemesa okukola n'enjiga okukola okw'obwangu essimu eyo oba ogikutte bubi mu ddirisa nze nyanguyira okunfunira ssente.
The commonly abused substances that lead to addiction include marijuana, crack, heroin, cocaine, and prescription drugs. Mutungo Viola, who is undergoing rehabilitation, explains how she got addicted for 4 years to tramadol, a prescription drug.
It all started in the hospital. I was admitted after giving birth to my firstborn. So I was admitted there for 2 weeks. They treated me they used it as a painkiller. So after that, because it's supposed to be used for 5 days, 3 to 5 days, but they exceeded from those 5 days to 2 weeks. Then from the hospital, I became addicted. So I started using it myself. I started injecting myself, cannulating myself.
The rehabilitation initiative of these young people battling addiction is being supported by the Presidential Initiative on Rehabilitation and Skilling of the Ghetto Youth.
After rehabilitating them and through medication and detox and so on, we send them to various skilling centers after vetting. So this vetting is done by professionals.
Our target population, mostly the ghetto youth, because they have no help. They have nowhere to run to. Most of the services are paid for. So we are trying to make sure they are easily accessible to these ghetto youth so that we can have a big number. The number we could target is around maybe 5,000 in the next 5 years, probably, so that we can help the country.
Facilities like Butabika National Referral Hospital and various NGOs providing rehabilitation and addiction treatment have been overwhelmed by a rise in cases after USAID funding freeze in January this year.
The USAID project, which was the medically assisted treatment program, had given these people a lot of hope. Some of them have been in addiction for 30 years, and finally they felt like there is a way to get out of it that means controlling the withdrawal that they were always afraid of or battling with.
Recovery Foundation, we want the government to come in and step in and help us to help these people reintegrate back in society. So reintegration is just the biggest challenge that we are having. If government can come in and we sit on round tables and discuss how we can help these people reintegrate back in society, then we shall have gotten a step ahead of substance and drug abuse.
Government spends approximately 25 billion shillings annually on mental health services, but beyond treating the symptoms, there is more to addressing the root causes. Diano Olwen Peters, UBC News.